Okay, with meningitis, these kids are sick. They have a high fever, an excruciating headache, confusion. They don't want to be in the lights. They can have a rash too. Can't put their chin on their chest. So do some research on that. Microcephaly, small head, precocious puberty. This is when children begin to develop and menstruate, develop breasts before the age of 8. Look at the Tanner stages for the female, so understand those too. How to perform a testicular exam, so review this and how you would explain to your patient how to perform an exam. Headaches, the different type of headaches, cluster, tension, and migraine. Tension headaches can last anywhere from a few hours to a week. Migraines don't typically last as long, but they're usually localized. Secondary amenorrhea. This is when menstruation stops after it has started. So look up on that. Babies in the sun. We want to keep babies out of the sun, especially before the age of 6 months, because before the age of 6 months, we shouldn't use sunscreen. And the importance of that is because they don't have a lot of melanin in their skin. Vesicordial reflex. This is when urine goes into the bladder. It shoots back up. So the kidney produces urine. It goes down to the ureters, into the bladder, and out through the urethra. When someone has vesicordial ureteric reflux, the urine shoots back up into the kidney, and it can cause scarring of the kidneys. This happens primarily in children due to poor muscle control of the ureters. This is something that occurs in children with Down syndrome. It is a instability of the bones in their neck. And if they are going to participate in activities like Special Olympics, this needs to be ruled out. RSV, we see this primarily, this is RSV season right now, fall and spring. We see this primarily in pediatric patients, and they have a clear nasal discharge and a terrible cough. It's a virus, there's no treatment, but sometimes these babies get so sick they need to be hospitalized and use oxygen and humidified air, especially if they are poor feeding. Croup is caused by a narrowed airway, and children who have croup have that characteristic seal bark cough. Groupie strep in the newborn. With newborns that develop groupie strep sepsis, apnea is one of the first signs that you're going to see in these kids. We started prophylactically treating all mothers who tested GBS positive for colonization in their vagina and rectum, I want to say probably 20 years ago, and that has greatly reduced the incidence of groupie sepsis in newborns. However, it has not eliminated it. Strep pneumo can cause a lot of things. It can cause meningitis, but I want you to focus that strep pneumo is the bacteria most likely the culprit in otitis media. H-flu also can be a cause of meningitis as well, and cellulitis. So H-flu bacteria. So I want you to also, when you're thinking about an illness, think about the bacteria. Okay, if a patient has cellulitis, I need to make sure that I'm using an antibiotic that covers H-flu bacteria. Now, H-flu is an atypical bacteria, so it doesn't respond to amoxicillin. You need to use a broader strength beta-lactam receptive antibiotic. So as you progress and become more comfortable in your skill set, you'll have a greater understanding when, H-flu, this is a cellulitis. The biggest culprit, H-flu, I need to use an antibiotic that's going to cover H-flu.